Lilly ran a study comparing Mounjaro, the newer GLP-1 combination medicine, against its older GLP-1 called Trulicity to determine whether it worked as well in preventing heart attacks and strokes. And the good news is the study met its goal. It proved non-inferiority is a scientific term, which is to say it did just about as well as the older drug. The bad news through the lens, I think, of a lot of investors is it didn't prove to be superior, which was kind of the, if not expectation, then kind of hoped for outcome here.
So what's the biggest business here for Eli Lilly? I mean, is Mounjaro one of their front-running drugs that we're talking about here?
It is. So Mounjaro it's a little tricky because it's the same basic medicine, but when it's used for diabetes, they call the drug Mounjaro. And when it's used for obesity, they call it Zepbound, but it's the same scientific molecule underneath it all. And that combined is by far Lilly's biggest growth driver. And it's a medicine that is in demand. It was until relatively recently in shortage officially, and it is definitely paving the path to Lilly becoming the most valuable drug company in the world. And it's also outpacing Novo Nordisk, the Danish company that really invented this market, that's also had a lot of unfortunate news in recent years. Lilly is lapping the competition there and is on pace, it's assumed, to kind of dominate this market, at least in the near term.
So I'm looking at the PGEO function on the Bloomberg terminal. It kind of breaks out kind of where the revenue comes from, either by business line or by geography. Cardiometabolic health, that's their biggest revenue line. Is that the obesity stuff?
Yeah, that's inclusive of obesity and diabetes.
All right, dude, I mean, look at this. Let's go 2021. That had $13 billion in revenue. Okay, good business. 2024, it had about $30 billion of business. Expected to be $43 billion this year, $52 billion next year. Holy cow. That is out of control growth. No wonder they're so valuable.
Well, exactly. And that's what we've demonstrated, what Lilly has demonstrated in sales just with the products that it has on the market. But I think when you look at the company's valuation, what's being priced in is a soon-to-come oral GLP-1. So they would have a pill.
That's what we're talking about.
That could win approval next year at the earliest. And that is likely to both be a massive commercial product for obvious reasons, but really like democratize this therapeutic category because these are all injectable medicines that we're talking about.
As the injector of this medicine on another person, which I enjoy. I get a cocktail out. We make a little party out of it. But the oral thing, that's going to open up the market like crazy, I would think. Because there's probably a lot of people that don't want to inject
don't enjoy
them.
doing the shots. I mean, because a lot of people don't like needles.
Yeah. And it's also going to probably diversify it. So a lot of the focus on these medicines is what percentage of weight loss do they drive? It could get up to 25%, for example. But for a lot of people, they don't need to lose 25% of their body weight. The pill seems to have a lower percentage body weight change, but the assumption is that there's a huge demand for that. And that when there's a multitude of these medicines, the heavy duty ones versus the lighter ones, then you could really meet a lot of the demand that people need.